often should I see the dentist is a question that we really commonly get asked. But the answer might surprise you. If you think about it, the reason we have checkups is usually to stop a problem from happening or to catch it early on before it becomes too bad. So the real question is, how long does it take for a problem to get from bad to worse? And the answer is that it's different for everyone. We're not all the same when it comes to our teeth, so it's crazy to use a one-size-fits-all approach. Personalised medicine is all about looking at an individual and taking into account their risks and their preferences before designing their healthcare solution. You can liken this a little bit to sunburn. So if you're someone with olive skin who wears sun cream and catches a little bit of sun, the risks for you of getting sunburn are really quite low. If you're someone with fairer skin, you might take some additional precautions like wearing a hat. And if you're someone at high risk, for example, a child or someone who's elderly, you might either avoid the sun or you might take some extra additional precautions like covering your skin altogether. And dentistry is similar. So when it comes to an individual patient, we consider what their risks are and then we design the solution. We don't agree with a one-size-fits-all approach, and the mantra of seeing your dentist every 6 months is not true for everyone. An example of this is some of our patients who we need to see very frequently. So patients who are immunocompromised that might have had radiation therapy or have a lot of trouble cleaning their teeth, we might see them every 3 months or even sooner because their risks of a problem going from very minor to very severe are quite high, and this process can happen very quickly. Whereas a lot of our patients who might just have 1 or 2 risk factors for dental decay or gum disease, such as diet considerations, frequent snacking, difficulty brushing certain areas, we would consider them lower risk but still at risk of problems. If they've got active disease happening or they've had it in the recent past, we might say, well, let's see you in 6 months because we're not sure that we can take it out to a longer period just yet. And then we've got our third category of patients who we don't need to see this frequently. These are patients with not a lot of risk of dental disease. They've got a good diet, they've got great home care, and they're doing all the right things to give themselves a low risk of dental problems. So one important role of a dentist is to try and help our patients move from a higher risk category into a lower risk group. And this is really a partnership that occurs between the dentist and the patient working together to decide what the best approach is for you.